Hello,
Hello.
ma'am.
Good evening, Dr.
Ma'am.
Lindsay. How are you?
Good, ma'am. I'm good. How are you?
Yeah, good.
Nice,
Sorry for
nice.
about the postponement. Totally.
That's okay, ma'am. That's okay.
That
Mhm.
was something unexpected.
Yes, yes.
Yeah.
Yeah, ma'am. You
So
can
I think you
just.
can start recording. I think once we start.
I just put it on YouTube now. It's already live. So
Mm-hmm. Okay. Do we start or should we wait for somebody to join
we'll
us?
just wait for some time, ma'am. Can you share your screen, ma'am?
Yeah. Are you able to see?
Huh.
So this is the first slide. Artha idena?
Ma'am. Yes. Could you put that on slide?
Yeah, I have put it, but it's not seen.
Okay.
Hold on. Now I will share.
Yeah.
Mm-hmm. Now?
Hmm. Yeah. Cool, ma'am.
Fine.
Yes, it's fine. Let me just disable the waiting room actually. Yeah. Good evening, Priya.
Good evening, sir.
How are you?
Yes, sir. Good evening, ma'am.
Yes, ma'am is going to connect with us. She just think. Yeah. We also have Sushmita Singh. Can we know which college are you from, Sushmita?
Hi, good evening, Dr. Priya. Priya is from your college, is it, Dr. Renzi?
No, ma'am. She's from
Hi,
Odisha.
good
Yeah.
evening.
I'm
Odisha. Okay.
Katak, ma'am.
Okay, GDC Katak.
Yes.
Fine. Who is there in GDC Katak?
Ma'am?
Who is there in GDC Katak?
Hema ma'am is the HOD and Utkal sir and Gaurav sir, Swapna sir.
Oh. Full GDC gang is only there. Okay. Okay, welcome, Priya. We'll wait for some more time and then
Yeah, ma'am.
start
Yeah,
the
it's
session.
just 6 now. Deepak is also joined in. Deepak is from GDC Shimla. Hello, Deepak. Good evening.
Good evening, sir and ma'am.
Hi,
Hi,
Deepak.
Deepak.
Good evening.
How's everything in Shimla, Deepak?
Fine, sir. Fine.
How's the weather now, man? How's the weather there?
The weather is like, sir, it's cold here.
Mm-hmm.
It's cold and it's raining actually.
Okay. All right. Okay, I think Anitha ma'am, we can start off because they will be joining eventually.
Yeah, okay.
Yeah.
Fine.
So good evening, everyone. Welcome back to the continuing session on oral health need assessment. We have with us Dr. Anitha Sagarkar ma'am, currently serving as Associate Professor and Head of Department at the Department of Public Health Dentistry, MS Ramaiah University of Applied Sciences. Thank you so much, ma'am, for taking out time and taking up this very important session for postgraduates. So we discussed earlier, various fundamental concepts on the various know-hows of oral health need assessment and why is it imperative for us to know the various methods of assessment. And today we shall be, of course, taking up a very few interesting case studies, which ma'am will be sharing with us. Once again, thank you so much, ma'am, for taking up this topic on request. And I'd like to just pass on the proceedings to ma'am. Yes, please.
Good evening, everyone. Thank you so much for joining over, taking out time to to learn a little extra, whatever, theoretically I have learned about oral health needs assessment. Okay, I'll just share my screen, see if you're able to see it.
Oh, we also have Dr. Chandrasekhar, sir. Hello, sir. Good evening. Sir is just joined in there.
Good evening, Delzi. Yeah,
Hi, sir. How are you, sir? All good there?
good. Excited for Anitha's lecture.
Ah. Okay. Thank you, sir. Thank you. Thank
Good
you.
evening, sir. How are you, sir?
Fine, madam. Fine.
Okay, thank you, sir. Okay, so here we go. Thank you so much, sir, for joining over. So whatever little I know, I'll be sharing in front of all these stalwarts, of course. Okay, good evening, everyone. Thank you for joining in over again. So let's start with this interesting session today. Oral health needs assessment. We have previously learned a few things. I'll just brush through the topic and then take up the next second session. So before I begin, Guru Bhyo Namaha, thank you so much. I would like to place a special and heartfelt thanks to my gurus and of course to my subject and my students and Almighty and of course PhD 101. So this is the second session. In our last session, we had some interesting contents. The 6 genuine questions that are asked by any epidemiologist. We all come across this very commonly asked why, which is learned in the form of rationale. I give a different perspective here. Why not? In the form of epidemiology.
Okay, there seems to be a network issue. Yeah, I just request everybody to please wait. Okay, we also have Dr. Manjunath Puranik, sir. Good evening, Manjunath, sir. Nice to have you here.
Yeah, good evening, Dr. Denzi.
Yes, sir. Thank you so much. Today's topic is again very interesting, sir. So I think that's why we have a lot of teachers also very keen to listen to Dr. Anitha for the session today. Okay, I think we'll just give her a minute while she reconnects. I think she's just connecting. So in the previous session, actually, Dr. Anitha was addressing a few fundamental questions here. As I'm sure all of you can see this as to how the understanding lies. Now, penultimate, what we have here is why, what, when, who, how, and where, which originally talks about certain specific details. But here, I think what Anitha ma'am was trying to explain was related to why not, and what if, and when not, who aren't, and how shouldn't, and where isn't. So we can notice here, I think in the previous session, all of us did note, in detail the various details. Okay, so be it returning to the deeper understanding, or rather questioning the existence and the alternatives, like, what if it's like this, what if it's like that. So when we come up with such open-minded approach to your entire need assessment, and then you eventually come up with creative solutions. Now also we also talk about when we have to observe some amount of caution, or when do we avoid, and then who aren't the people who are non-benefited, and how you shouldn't, which is methodological nuisances, and where isn't. So that's about irrelevance. Yes, Anita, I think if you've joined us, you can please take over.
Thank you so much for that continuity of explanation, Dr. Denzi. Yes, when we face technical glitches, that is where we get hampered with the, yeah. So this is a slight variation that I just try to give it across to you people, where apart from the 6 genuine questions that we ask, go a little ahead, stretch a little ahead, and see what is a deeper understanding of the information that we are trying to. What we do, this with my personal experience, I would like to share is what we Indians as researchers, we try to do is we try to flare out like octopus in all the areas of research. We do not dwell into one area and we do not get into deeper. If at all we are doing one type of a research today, after 10 years, I will be called as an expert, or after 15 years, I will be called as a person who knows a little extra compared to others, because the number of times the research that are taken up in that area is so deep that any question sliced in any way, in any form, through any criteria, I will be able to understand. So I think you people as a youngsters, of course, we do have some seniors who have done real good research in different areas. With all due respect to them, they are called experts because they have taken their steps, every steps countable in the same research area over and over and over again, to be called as masters in the areas wherever they are working. And what if, of course, the creativity lies in how we dwell into based on the literature, not only just the research point of view. Get that experience of your supervisors whom you're trying to work with, and there it gives a slight creative tone to it. And then, most important of all, as we as supervisors or guides, and we need to caution the postgraduates or the undergraduates or whomever we are researching or trying to collaborate. What are the points that we have to keep in mind to avoid, or as a word of caution? And whenever we do a research, it is very essential to understand who are the set of people who are going to be benefited and who are not going to be benefited. This discretion is so soulful and very important, because once we crystallize the boundary of the beneficiaries, that is when actually that gives a proper crystal clear information about who are the target population who are going to be benefited from what program we are doing. At the same time, if at all we have a population is very close to this kind of a research area or a oral health problem, we can also look at them a little later. How shouldn't the methodological nuances? We usually generally jump into RCT. See, doing a RCT in a public health scenario may not be acceptable all the time, because we're not doing experiments basically. We're doing field trials, we're doing community trials. So it is very essential that we see how a research question behaves, how the study subject behaves in the community setting, or that setting based approach is very important for us as a public health professionals. And where the relevance, why the way we understand relevance, where it stands as irrelevant is very also important. Because as I mentioned earlier, Google gives us so much of overwhelming information. We do not have a proper boundary to say that these are the set of relevant information that I need as a researcher to summarize it as a literature review, or these are the set of information that I don't need. So that discretion is very essential, though it is very subtle. Now, previously we have learned a few things. Rationale of oral health needs assessment, of course, with the background of health needs assessment. Then we differentiated 3 common things which are, well confused basically amongst the students. What is the difference between need, demand, and supply? And today Predominantly, I'm going to enumerate the elements of comprehensive measure of oral health needs assessment. And of course, we're going to take up a few studies, case studies, and systematic reviews, which I'll be sharing. Not much in detail. I'll be sharing the material over to Dr. Denzi, and he will pass it on to all of you. And few research priority areas in both Indian and global context. So, is there any need? Now, first of all, as a beginner, all of us, we would have had a doubt. Okay, fine, if it is dentistry, if it is a dental camp happening, we're just doing a dental treatment needs assessment. Does it person require treatment? Yes or no? That's all. Now, what is that which we are going to assess beyond this? Is there any need for comprehensive assessment? This is a very important question that we need to ask, because we are looking at patient despite whether he's treated individually at chairside or at the community setting in a very holistic approach. Now, that in mind, we have to understand that taking a comprehensive approach is a mandate for all of us. Yes, I would say a very big yes. Yes, 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 because this helps as a researcher for all of us to get rid of the deficiencies that we have got only with the normative need, or when we as healthcare professionals have tried to assess with the patient. This is when we fail, because there are different layers of assessment that needs to be overlapped to see the real presence of what is the need for a patient. We should not stop at just the professional judgment that says these are the requirement, because I let us say I have a beautiful WHO stepwise approach or 2013 pro forma in my hand. I fill it up all, and I have done a real great research, and I will be cursing as a postgraduate two people. I have done such a nice study, and why have they not given me prize in the conference and all? Because we don't understand. I myself, at least as a postgraduate, I had a difficulty in understanding that, okay, apart from the treatment need, there are so many other things that we need to assess about a patient. So we have to understand that there is a very much need or demand for the comprehensive approach assessment. Now, what is that we need to look at? It's something related to the behavioral aspect of a person, how this impacts, oral health related problems. How does it impact an individual, be it his daily activities or his, uh, his school going habits or his workplace habits, etc. And how we as an individual, or rather as a patient, how is it going to perceive? Does it help, whatever the kind of hi-fi information we are passing on to the patient, will he follow that information or not? All these perspectives when put together will give a comprehensive picture and will help us understand whether a person is being assessed at the different layer, so that we get a comprehensive picture of that patient. Now, what are the comprehensive model for assessing dental treatment needs? A new comprehensive system has been put forth, and that is called as a socio-dental approach. Now, as the name goes, socio-dental approach, what is the rationale of it? It assesses the need of a patient, and consequently, it will be very, very much useful for a program planning for all of us. See, because when we say we are a public health professional, it not only gives information about the treatment. I am reiterating this concept because it is very essential that we assess the patient from the different layers, so that we get a comprehensive picture about the patient per se, that to en masse. So what does this new system include? First, which we very commonly do it, the clinical estimates of the normative need. Next, we take up the general health status. See, here we are giving importance to general health status also. Third one, the subjective perception. The fourth one is there's some concept called as propensity for health promoting behaviors. And the last one, whether whatever the program that we have planned or oral health need that we have assessed, is it effective or no? Coming to clinical normative needs that we generally do, the clinical parameters that we assess, the soft tissue related findings and the hard tissue related findings that we generally do normally day in, day out. And then next, so after covering this, the second point is the general health status that we are going to check. Now here, what are those general health status that are important? there are several points related to general health. How do we check these components? For example, if at all a patient has a periodontal condition which is worsening despite your intervention with several types of treatment, here we have to understand that the presence of any systemic illnesses, for example, like diabetes mellitus, is going to worsen, is going to create definitely some or the other kind of problem to the patient. Though he is very sincere, though he is very compliant, though he follows all the instructions that you have given and everything, that's all. Because here it's not only the patient compliant related in thing that is failing there, the systemic condition of the patient is failing. So though there are several components related to oral health, there are several components related to general health. We are going to pick up what is the main primary problem the patient is facing related to oral health, and what is that general health component the patient is suffering, which is said to directly or indirectly affect the patient. Next. So we have finished with the first two components and then coming to the subjective perception. Now, what is subjective perception? How a person feels or perceives whatever the about his own oral health. Is he going to feel good? If at all, why is this perception component assessed? Now, try doing this to your friends. Just go there and ask them, okay, how do you feel about oral health? Generally, they don't have any spontaneous answer to it. They end up answering to you, I feel it's okay. So such vague answers come. So if at all you dig down and start questioning a little more and try getting their perception a clear picture, then you get to know that whatever you have assessed clinically as findings and whatever they perceive about their oral health, there is a mere inconsistency in this. So that is when, the subjective perception, that's the reason not only we are assessing the normative need, but we are taking the subjective perception also to know that how they are perceiving their oral health. That is where the psychological aspect comes into picture. That is where the behavioral aspect comes into picture, and that is what, the key point where the behavioral interventions are needed. Now, so what does this subjective perception of the need measure? Of course, the perceived need of the dental disease itself and the dental treatment also. And coming to how it's going to impact their, as I have mentioned it earlier, their day-to-day activity and their quality of life. Especially it is categorized into health-related quality of life. For us, it is oral health-related quality of life. Now, I have picked up OIDP as an example here. Let us see what theoretical background it has here. They generally assess the 3 levels of oral health status here. Now, let me tell you, let me just go back to that, this slide very importantly. I will reiterate this slide very importantly because there are 5 different components that are assessed: clinical estimates, general health status, and subjective perception. So we have come to the subjective perception, how it is assessed, for which I have taken OIDP as an example, oral impact on daily performance. Level 1, oral health status and oral impairment that are assessed, just like how I put it in the list. Second, the intermediate impacts like any kind of a discomfort or a pain or some kind of their daily activity limitations. For example, if the patient has pain because the tooth was extracted 2 days back, he generally will, though you instruct them, eat soft, don't eat spicy food, khara tinnongilla, don't eat hot food, everything you will have set of instructions giving. But after 2 days also the patient may say, I'm not able to eat even the soft food that you are trying to suggest. Or if at all a patient has a grossly decayed tooth and it is unattended or untreated for a long period of time, how does he feel? Though he is not willing to go and subject himself for any kind of a dental treatment, he will avoid chewing on that side. So there is a functional limitation because the chewing habit gets shifted only to one side, which is not painful for that patient. And over a period of time it so happens, or they may have some kind of dissatisfaction with the appearances, especially if they have malocclusion or something like that. So these are all the components that are covered in level 2. Now, what is level 3? What is assessed in level 3? These are nothing but the ultimate impacts, Despite with all these problems, oral health related issues and problems and discomforts and pains, are they able to do their daily activities? How this impacts their daily performance? Will the child go to school? Will the adult, is he able to attend to the workplace where he is planning to go, etc., etc.? If not, what are the factors that are directly or indirectly related to this? So this OIDP is one example I've just picked up. So these are the 3 levels that are assessed. This is in accordance or in concurrence with the 3 elements that I have already addressed. So we have finished with the 3. Let's come to 4. This is my personal favorite because propensity for health promoting behaviors. I wake up every day. I assert, for example, with my own example, I affirm myself that I'm going to do exercise for 90 minutes straight when I visit gym today. So when I reach there, I end up doing just 45 minutes. And once it reaches or hits 50th minute, I will psychologically I'll start feeling tired. So I have a natural tendency that I stop at that point, and my coach ends up telling you go for a cardio workout after this, and 20 minutes of a cardio work, and that becomes like 1 hour 15 minutes or so, and I'm out of the gym. Earlier when I affirmed, I had a feeling that I'm going to work out for 90 minutes, but there was a general tendency where I leaned in and I ended up working out only for 45 minutes. This is called as propensity. There is a leaning in or a natural tendency of an individual, to behave in a particular way. Now, coming to the oral health example, if I have to tell in particular, now let us say you instruct your patients, please brush twice a day without fail. The day they visit dentist, next day, second day, third day, maximum with 2 days it will pass, and on the third day they get back to their natural inclination where they just brush once a day, and that's it. That is where the propensity is given importance. Whatever, despite the instructions are given, the patients, they tend to lean or they snap back to their natural tendency. Now, health promotion behaviors, I have stated a few examples, like how I gave my own example. And healthy eating, again, I'll give you my own example. Like today I decide, I'm going to eat half a papaya. And yes, I have feel a kind of a feeling of a boredom or whatever the reason certain time. There's so much so heavy that I end up eating my proper breakfast and leave fruits to our side. So stress management, sleep hygiene, healthy relationship, these are all the different examples which are set to directly or indirectly have an effect or impact on our health. Now, propensity related factors, I will give a very good importance to this component because patient compliance comes into picture here. Now, whatever we have, it's not only propensity, it's not only the natural inclination the patient has, how we diagnose as a healthcare professional. We generally, now this point I have highlighted very importantly because when we go to camp, we have that on back of our mind all the time. Okay, anyhow this patient is going to be referred for specialty treatment. Why should I bother? Refer to prosthodontics. Over. Refer to surgical treatment. If the patient has ortho treatment, referred. We actually do not write the proper diagnosis to the patient, correct diagnosis to the patient. We have a feeling that of letting it off the diagnosis component. Now once we do that, we must understand that there are chances that the patient are not going to stay compliant with whatever the further instructions that we give as a doctor to them. So that's the reason it's very important that we correctly diagnose, have a rough bird's eye view of whatever the treatment that the patient has to prospectively go through, and give a picture about what could be the financial load that patient have to go through. And of course, this creates a clear picture in the patient's mind. Therefore, they become a well-informed patient. So these are the factors that are very important for patient compliance. Though we speak a lot about propensity, this snapping back to their natural behavior are predominantly dependent on these three factors. So how we interact with them, what type of treatment we provide, and how informations are conveyed to them, how they feel confident or do they feel credible about whatever the information that we give them, etc., etc. So examples are, like I have stated before, propensity. Most importantly, we ask them to brush twice a day. The frequency of toothbrushing is what I have put it here. And if at all we look at their diet chart and we observe that, their diet has increased sugar uptake, and we tell them, okay, Node, you are taking 15 times sugar. Please reduce it to less than 5. We very bluntly speak without understanding that what should be the treatment that we are providing to them. And the moment we speak to the patient with no weightage of what information we are putting across to them, there are chances that they will get back to their original behavior. And this happens especially when you're talking to patients about their tobacco usage or their alcohol intake. First of all, the patient will feel very embarrassed. You have gone to the camp and you're trying to interact with them very occasionally. They are not the people whom are going to meet very frequently or often. And moreover, we start asking questions like, okay, ನೀವೀಗ ತಂಬಾಕು ತಗೊಂತಾ ಇದ್ದೀರಾ, अब आप tobacco ले रहे हो, कुछ देर के बाद आप बंद कर दो. That's all. These are the very blunt way of telling we tell. So with these as an example, we have to understand that propensity or natural inclination for them to get back to their original behavior, the chances are more. So here we have covered with the 4 components. That is, one, the clinical estimate, which we generally do. Second one, the general health status components that are, directly or indirectly related to oral health. Third one is a subjective perception, how an individual patient feels about his or her oral health. And the fourth one is propensity, the natural inclination of an individual towards or away from the health promoting behaviors. And the last component is the scientific evidence on the effectiveness of treatment. How effective is the treatment that we have provided, or rather the health behavioral intervention that we have provided? Is it really effective or not? Of course, we do conduct different types of appraisals if we meet the patient individually in the camp or at the clinical settings. And apart from that, from the research point of view, it is recommended that you conduct experimental designs, field or community trials. And as we all know that of all the hierarchy, what tops the list is the difference conducting systematic reviews and meta-analysis. These are the different way of assessing whether whatever the kind of behavioral intervention or whatever the treatments that we have provided, whether it is effective or not. Fine. So here completes the 5 components. So if anybody has any doubts, you are open to ask your questions to me.
Yeah. Any doubts from the audience?
Or if you have any perspectives that you want to add to the point of view that I shared, also welcome.
Anything else from anybody? Ma'am, I had a small doubt from my side. I just wanted you to elaborate a little bit on the subjective perceptions. Actually, when you're looking at that aspect, how are we going to address that?
Okay, see, perception is, there are several questionnaires that are available for perception. So perception can be like, related to oral health, basically. So this is nothing but how I perceive my oral health. Do I feel good about my oral health? Am I satisfied about the number of times I'm brushing? So if you look at WHO 2013 Proforma, the first component, there is a content called as perceived oral health status. So there is a separate questionnaire for itself. So that is, there are several questionnaires available for it. That's the reason I picked up OIDP. And when you say, oral health related quality of life, so how this oral health related issues are affecting our day in, day out activities. So there are several questionnaires to it. Depends on what you want to assess. It's not only about oral health directly, only about the teeth itself. I can also talk about the malocclusion. I can also talk about how I perceive about presence or absence of halitosis. Anything related directly or indirectly to oral health will be assessed. Another example that comes to my mind is OHIP, Oral Health Impact Profile, for geriatric patients, where they assess the different levels of, their functional limitations, their, the chewing capability. So like that, we have 5
What
different.
they think about their oral functions.
Yes. How they perceive about oral
Perceive.
health themselves. Yeah, this will be mainly self-administered questionnaires. They will be.
Okay.
So they are going to perceive. So, and the Likert scale is used, and different gradations are given. So the patient is given an option to choose whatever.
Okay.
So when we do any kind of behavioral interventions, we are going to assess whether there is a shift towards something positive with this kind of an intervention.
Okay. Thank you, ma'am. Yes, Deepak. I think Deepak has a question. Go ahead.
Ma'am, the propensity of health promoting behavior, is it affected by the subjective perception of the clinician also?
Yeah, I would say yes, because see, for example, if my core values are very strong as an individual, am I audible?
Yes.
Yeah, if my core values related to health are so strong that, imagine a person who is very assertive. You meet a patient who is very assertive, who is well informed, his awareness level is high, his health literacy levels are high, and you try to explain to him these are the available options for treatment, and you go ahead. What are the chances, do you think, I will agree with whatever the options you give? Will I agree with whatever the treatment choices I give, I get from you as a doctor, or no? I hope I'm clear, Deepak.
Yes, ma'am.
So if you meet someone who has their, clarity about health related information with them, a better understanding, or rather a deeper understanding, so that will affect them. So my perception will be always good about my health or oral health. So if you as a dentist, you give me choices, there are all chances that I will respect it, I will receive the treatment, and I will be very highly compliant, and I will follow all the instructions, and the chances of treatment will be better. So when you give me set of instructions to follow, there are chances that I will not lean back to my natural tendency, which may be, a little negative, or, when I get tired, okay, I'll brush when I'm not tired, kind of a feeling will not come to my mind. No matter what, मेरे डॉक्टर साहब ने ऐसे बोला है, मुझे करने का ही है. That kind of assertion I'll have.
So they can be more like persuadables, ma'am. Like when you look at in that sense. Okay. Yeah, I hope that's clear, Deepak.
Ma'am, that means as a clinician, we need to improve our practices also, no?
Of course, yes. Because I emphasize a lot about communication to everyone. Indeed, just today morning I was telling our students, see, you might speak to the patient. There is a difference in, I'll give you 2 sentences and you see the difference. Okay. A patient comes to you and he says, I have tobacco chewing habit. I'm a driver. I have no choice. I drive overnight. So I chew tobacco. What we as a final year student, how we speak to them is, okay, you have to stop the tobacco. Okay. Sentence 1. Sentence 2. I, as a dentist, will explain to you what are the ill healths of tobacco, which you already may be knowing. At the same time, I will help you choose what are the alternatives. So which one do you think the patient will uptake? Will the patient agree for the first sentence or the second long elaborative sentence?
And second one, the alternate.
So do you think with the first sentence my practice will improve, or the second sentence my practice will improve?
The second one.
Okay, so then do you think as a final year student you will suggest me shift from first sentence to second sentence?
Yes, ma'am.
Right, so that's all, that's the difference. So the way we communicate, because what happens is dentistry, we always practice a fear-based practice. We always tell, अगर ऐसे नहीं किया तो आपका दांत को निकालना पड़ेगा, 6 महीने आपका दांत गया. So this kind of, we have to shift from, if you ask me on a contrary, I will tell dentistry is a luxury service. We have to shift as a practitioner from fear-based practice to luxury service. The best example I relate to is we meet air hostess once in a lifetime. But the way they made us feel, we will remember it for lifetime. We will not go to Indigo for the sake of that flight brand or anything. We want to go because we want that kind of a good feeling that the person gave. So I think we have to shift our fear-based perception towards, we have to start thinking that dentistry is a luxury-based service, and automatically our communication towards the patient will change.
Thank you, ma'am.
Yeah. Thank you,
Yeah.
ma'am. I think.
Okay, so we'll go ahead here.
Yes.
Okay, so we have finished with effectiveness of treatment. Now, again, with the same example, I have given, another tabular representation where they have given 3 levels of assessment. Dental need, standard normative need, where we usually check for the clinical impairment. Second one is the impact related estimate of need. Here, I put sociodental need as a component here because we are not only assessing the clinical impairment, we are also assessing the oral health related quality of life. And the last one, of course, the propensity related need, where not only the clinical impairment, not only the oral health related quality of life, plus the behavioral component of an individual where there is a natural inclination towards positive or negative can be assessed. Now, here if you look at this table, you are seeing that there is a layer by layer information about the patient that is assessed. Okay, so this is another study which I have picked up from BMC research notes. This is a very nice one. Again, the same 3 levels, how they have assessed. They have assessed with a different questionnaire over here, but they have checked for the same components: clinical impairments, oral conditions, where there is no oral health related quality of life is assessed, and then healthy lifestyle components are assessed, where oral health, oral hygiene practices are assessed, diet chart is assessed in depth, and that becomes the last level, that is propensity related need. And also the family condition is assessed. See how beautiful is sociodental approach. It's not only about these components, where a person lives, a subject or a patient, as a component of his family. All the factors or parameters related to the family are assessed here. Like for example, who buys, best example I relate to always is, for example, you talk to a student and you ask him, do you buy the toothbrush and toothpaste at home? Most of them say no, except if they stay in the hostel or if they are on their own independently. There are all chances that if you treat such patients, they will wait for the third person, his head of the family, either mother or father, to take the decision for him whenever you give them a treatment choices. Here, the propensity related factor becomes very important. Here, अगर पापा हाँ बोलेंगे मैं ट्रीटमेंट लूंगी, अगर मम्मा हाँ बोलेंगे मैं ट्रीटमेंट लूंगी. There are no chances that the patient will tell अरे मुझे चाहिए, I will take the treatment. Very less chances, because there is money involved here, there is treatment that is going, and a follow-up also is also involved after this. Now people might argue, oh, we are in a generation where they demand and get the treatment done. Yes, it's good. At the same time, you have to understand that there is an what to say dialect there. They do demand and they do completely ignore. Example: increased intake of fermented food, fermentable foods like these all these breads or burgers, all these bread based foods. Okay, so how do you test this socio-dental need? Of course, examine those 3 parameters that I have already emphasized on. Check pre, do a particular intervention that you're planning for, behavioral intervention, and check for post. I have added a few examples of case studies and of course a few literature review in the form of a planning model. So let's have a look at. So oral health needs assessment. This is one very commonly, examined one, which is called as ASTD, 7-step needs assessment model, where The first step is identifying the partners or the stakeholders who will become the partner component of advisory committee. Second, conduct self-perceived or self-assessment of the determined goals and resources. Of course, we have a goal that we have to achieve or attain optimal oral health. At the same time, what are the resources that are available? The beauty about this model is where I just spoke about the three parameters. Here, they are involving the different stakeholders from all the streams, up, mid, and low. All the streams, and also they are assessing the availability of resources beforehand. And in step 3, it comes the needs assessment, where it is categorized into two. What are the core components that will be assessed, and what are the optional components that will be assessed? And then mandatory literature review will be conducted, where the primary and the secondary data both will be appraised, and then determine the need by primary data collection, and also cross-validate with the literature review that have been identified, match with the resources, set a priority, and then go ahead with the needs assessment. Step 4 comes the data collection, and of course step 5 data management and try getting the results, and step 6 where there will be prioritizing of whatever the health related or oral health related issues that you are going to identify. Here I will bring your attention to step 1 back here, where we have a set of stakeholders, where we have representation from up, mid, and low, all the three streams. This is where they become important or significant, where the information, whatever we have collected, the perspectives, whatever we have taken from different stakeholders, they will be utilized for program planning, how advocacy can be done, and how the resource allocation can be done effectively. So since they are involved right from the beginning stage, there are all chances that their cooperation will be better. And then, of course, the last step, we are going to evaluate whatever the data we have collected. I hope this is clear. Very simple. Of course, it rings the bell very close to the 6 steps that we have for the health planning, but they have done it in a little slightly different way, much elaborative way, where they have emphasized on the availability of the stakeholders right from the beginning of the study. So I would bring your notice to a few research priority areas, which is I have taken it up from one of the study where they have done the stakeholders perspective. So these are the different, see, this is why this slide is important. I'll tell you. We usually end up taking up those research topics which are either my favorite as a postgraduate or the supervisor's favorite. Instead, I would recommend, please go through different, there are in international platform, what happens is they conduct several researches which are involving even today different stakeholders. The decision making is made on the spot through this workshop. I love this workshop approach because they take the decision there itself and say, these are the problems, these could be the solution, and go ahead and solve it. So likewise, this was one of the study which was done, where they took help of research stakeholders related to dental public health, and they have found out different research priorities that needs to be done in oral health needs assessment. Number 1, what's the most effective method to change behavior to improve oral health? So oral health promotional component is important there. Then oral health ke geriatric population, or a target population, geriatrics especially, they have told that it's very important. What is the relationship between chronic illnesses or the systemic illnesses or conditions and the oral health? And what is the effect of preventive interventions that includes oral health education and several preventive protocols that we follow, like utilization of fluoridated toothpaste and chairside health education, oral prophylaxis, etc. Next, so like this, we have a set of priorities that are set in this workshop. These are my personal favorites because I myself didn't know as a postgraduate student that this is the way we have to pick up the research area, so that we fall into the global priority. So that if we have to answer as a researcher, what is the pressing issue, both locally, it's like, think global, act local. We must follow this theme. we have to see what globally everybody is suffering and see how it can be translated to Indian scenario, how that can be written as a research question, how it can be addressed. So these step by step approach has to be mandatory followed, rather than going by favoritism concepts where we might end up falling nowhere. It might or might not, but this is the best research approach that could be taken into consideration. So these are the key references. The presentation will be shared with Dr. Denzi, so you can take it from him. So any additional case studies and theses that I come across, including a few systematic review, I'll be sharing it with you. Thank you everyone for joining in the session. So there ends my session for today. So if you have any questions, open for discussion, or if you have any perspectives, you can share. I see Dr. Manjuna Puranik sir is online. So thank you so much for joining in. So if you have any perspectives, you can share.
Yes, Puranik sir. Thoughts on the session?
It was a very nice presentation, Dr. Anitha. I thoroughly enjoyed your presentation style.
Thank you so much, sir.
And also you covered a lot of areas. In fact, I missed your first presentation. Thanks to Denzi, I think I will see it on YouTube shortly. But otherwise, this presentation I think was well covered, and especially the last slide. Your perspective of selecting research topic, I think, is very nice. But only thing is, how to do this is a question. Especially when PGs join the specialty.
Yes.
See, the traditional approach is like what we do now at present in the department is that we ask them to select the topic of their interest. So they come with various topics. And finally, it is the student who is choosing the topic, and we don't give our topics.
Yes, sir.
That's what I have followed for time. But your workshop topic is, in fact, is ideal.
Yes, sir.
Yes, sir.
But how to go about is something I think we can discuss.
Small point to add in here, Manjunath sir.
Yes.
Now, the ability to decide a research topic requires a certain level of aptitude. I think it's got to be to make the postgraduates more enabling. I think we need to given the main areas which we're focusing upon, and then probably help them decide better. Because once they remain undecided, there's an equal probability of tossing the ball, or I would say, putting it out of context. So I think a little bit more. I would say probably. I mean, this is a wonderful approach what ma'am discussed. So focus on the thrust areas and these priority areas, and what is expected of, because dealing with certain aspects like what ma'am mentioned, nutrition, preventive interventions, or social dental approaches, all of these things. I think that's got to be fed to the student to develop the understanding. I personally think so.
Another aspect, I think it is followed in the West, where when the student joins a department, there would be always an ongoing research.
Yes, sir.
So student joins the particular department and he gets funds and can continue one of the areas in ongoing research.
Okay.
But I think we have not thought about that here. That's something which we can also do.
Yes, yes, sir.
Surely,
So, though I would like to add a point here, sir. Though we have finished our post-graduation several years ago, now if at all now even the PGs when they come, they give a set of articles to us. Ma'am, these are the articles we want to pick up for research. There, just it is based on the last 5 years literature. 5 years is the time frame is the only thing that we give to them.
Yeah.
Just pick up some article which is from last 5 years. Predominantly, let it be last 2 years. This time is the only frame that we give. So then I start. This was my personal doubt I had. How is that they have to pick up the research question? They may not, because where funding when happens, they look into these parameters. When they always tell, ma'am, I want to do health policy related thing, but nothing is happening in India. So these were the doubts they would come up with, for which I did not have any answer personally. So that's the reason I went ahead and I learned this concept, where there is something called research priority setting workshops. That series of it is happening in different parts of the world. And that is where, oral cancer related health literacy tool was developed. That is how me and our postgraduate student, we arrived at, there is no health literacy tool related to oral cancer, and that has to be developed. It was very difficult for the first time, but somehow we could manage, and we developed oral cancer literacy too.
Right, ma'am. Yes, I think sharing from experience there, as Dr. Anitha mentioned, the research priority settings firmly establish like a template and give us some points to think upon. Because again, like I said, I also have my own share of experiences where you sort of like lost, and like ma'am said, time is sort of a crude way of determining, or in some case, even a deterrent to actually picking up the right research topic. So I think if you could look into this, it's really a welcome move in that direction. Yes, sir. Any thoughts on that? Anybody else? Of course, yes. The house is open for discussion. Please feel free. I think we'd like to invite some of the postgraduates and what are their thoughts on that. If Dr. Deepak or Dr. Priya, if you could chip in your experience, how much would you think this would add value to what you are constantly pursuing?
And also, I will request one word to postgraduate students is that we have to understand that, we have a lot of new things to learn from you as a student. You actually open up our arenas when you come with different articles where you tell, ma'am, it's interesting. Sir, it is interesting. I want to do this. That gives a little of challenging situation to us. So, with this kind of a background, I am open. If you have a feeling or a perspective, you say, Anitha, ma'am, you were wrong at this point. I think you have to add this kind of an example. Or, ma'am, you please add. Okay, now I'll tell you, ma'am, case studies you are mentioned in the title objective. There is no case study here. There is no explicit mentioning of that. So, that critical kind of a thinking and sharing it with the stakeholders, I think that's very important. I'm open for it. If you have anything, either you can write mail to Denzi sir, he will pass it on anonymously. That will help me improve lots better, and I'll do justice to whatever the presentation done. Or if you can express it explicitly here, I'll be even more happy.
Ma'am, it was very informative, very interesting session, ma'am. Actually, I learned a lot, especially the selecting topic thing, ma'am. Usually when we search for topics as such, ma'am, we don't have this idea if it is practically feasible or not. Like sometimes everything sounds very interesting. Yeah, I can try this. Why not this? Why not this? Initially, especially in the first 6 months when we have to choose our dissertation topic, that was the problem, which even so our supervisors, they used to tell this might not be practically possible, so try to do this. So all those were the things which I had like felt during my selection topic.
Good. Thank you.
Yes.
Yeah, I would say one point. Yes, sir. Yes, sir.
Yes, sir. Please, sir.
No, I think it's you have to answer. Then I'll talk.
Yes, sir. Yes, sir.
It's
So,
your
and
turn.
I'll feel one thing, Dr. Priya. We
Yes, ma'am.
also change the way the research is being, propagated. Why? You ask me, for example, research is one way to meet stakeholders, one best way to meet stakeholders. Now, for example, I am willing to know what is it, Dr. Sudhakar is up to. If at all I pick up a research topic where I will meet that upstream stakeholder somehow and I will try getting the answer, though he may or may not answer it directly. At least if I get a one-liner or two-liner answer through a secretary or somebody, the perspective comes from there. Fine. And then I'll pick up a set of midstream stakeholders and then a downstream. So this kind of advocacy approach based research, I think has to be taken up by all you youngsters as a staff, That will be a really good move. We'll get to know a lot of people. We'll get to know how their perspectives are. I will feel why they have not funded my study. It's just 10,000. No. But as a health minister, he will think where that 10,000 should go. What are the parameters he considers to say that decision for an Indian context? How the same decision will be changed for a developed country? So these perspectives are all possible when we move out of our department and we start doing field based trials and we start meeting people, different stakeholders. we have to and we must get the blunt perspectives from different people. That is where the perspective synergizes and we come up with, solutions which actually matters to our specialty. Yes, sir. Over to you, sir.
Yes, sir. Manjunath, sir, yes.
Yeah, thank you so much. With respect to the topics, maybe I can add my perspective. The conferences usually comes with focus areas. Any conference, and similarly is ours. This time also we are coming with the focus areas. So there are 10 focus areas on which the PGs will be presenting the papers. Okay, that will happen in this conference. But from next year onwards, like our specialties, we can take these focus areas as guide points. And we can ask our students to conduct research. For example, tobacco and oral health is one focus area, or interdisciplinary research is another focus area, or translation research is another focus area. Hardly we are doing research in some of these areas. Probably I think these 10 areas can be considered, I think maybe from next year onwards, so that whenever conferences are called or presentations are there, we are ready with the papers. So at that time, we will not have any confusion to see where our paper is going to fit. That is something I think which we can also think moot among ourselves. Another thing is with respect to the research that done by the postgraduate students and by the department. So the postgraduate student, mainly the concentration would be to learn the research methodology and the biostatistics. So once they learn the trick of the trade, probably they will be able to take up better research works when they become faculty. So for that reason, I think as departments, again, I should tell that we have not done that. Maybe we can do it, where we can have two streams. One, postgraduate students will be doing the research as a part of their postgraduate curriculum. Otherwise, also department has some ongoing research where the faculty members are the investigators, and PG students may also join such research work, so that they come to know how the funded research works. So what are the requirements? So side by side, they also get exposed to different types of activities that goes on. Whatever Madam Dr. Anitha you put it, it's very clear, very nice, that when you approach for the grants and other things, the perspective of the person who provides a grant is totally different. My experience here, when we evaluate papers for Rajiv Gandhi University, that is for the grants, the first and foremost question is this research useful for the society? So it is not just that you are doing research for the sake of research, because your research is funded. So there should be a justification that my research is going to help the society at large. If that type of originality and significance is there in our research, then probably I think our contribution is going to be useful for the society. Otherwise, it is not going to be useful for anybody at all. Thank you so much, Dr. Denzi.
Thank you, sir. Thank you. I think those are really valid points, as you suggested. And in fact, really happy to know that we're going to be having focus areas from our conferences, and also certain points which you mentioned. So I think research in the end has to contribute and serve a larger purpose. The greater good is important, and we've all experienced this when we apply for grants. The first and foremost question is often asked this way. So when we keep all these parameters in mind, I think like how Dr. Anitha started off a discussion today, I think that was really commendable. That we're actually having this fruitful discussion in that arena is a good starting point. And when we look at the bigger objective here, again, when we talk about community oral health need assessment, it's merely beyond just collecting some data or trying to assess what we think, or rather what the patient does not feel. It's more important to take in that, and of course the propensity topic which ma'am of course mentioned here. So all of these things give us a direction to think upon, and some points to think. So I think thank you so much, Dr. Anitha ma'am, for the session, for starting off a conversation in that direction, and we're really indebted to you for sparking off this and making us some food for thought there. Yes, ma'am.
Thank you so much indeed, for the opportunity given, Denzi. And of course, thank you, sir, for giving your time for being here, Puranik sir. Sir has always been inspiration since almost 15 to 20 years. Way back when I was a third year BDS student, sir would visit our college, and sir would so beautifully and so sincerely sit with us and explain what the subject is, how it comes, where you have to work on. And that kind of a mentoring has happened throughout. Even when I wrote my PhD synopsis for RUHS, sir was the mentor who helped me right through and through. So we were privileged enough that sir would come back to us even after he became staff. He would share his perspective. He would give the real life experience to us. So that actually made us think. And even when I reported as a staff to Bagalkot also, I was very new, navy, and nerdy types without knowing anything. Only all that I had in my pocket was just a bulk of energy, and which had to be filled with a lot of knowledge and experience. So sir would give his perspective and he would share. Even today, he sir takes out time in mentoring. I think this kind of experience matters a lot. Thank you so much, sir. I
Thank you so much.
owe this perspective to one of the very good mentor like you. Thank you so much, sir.
Thank you so much. Thanks.
Thank you. Thank you so much. Thank you, everybody, for our session. And thanks to you, Anitha ma'am, for taking this and, of course, putting together so much of important information. I'm sure this will travel far and wide. We will be sharing the presentation. And, of course, all of you can reach out to us, any of your postgraduates, if you need information on this, you can write to us, you can get to us, and we can get you in touch with ma'am as well. And thank you so much, and all of you. We hope, and like we said, the main purpose was to get the conversation starting and to ability to understand each other's perspectives, because in the end, public health dentistry, or when talking about dental public health, is all about how well we understand the pulse of our patients and the community at large. So thank you so much, Anitha ma'am. Thank you so much, Puranik sir, for
Thank
that
you.
guidance as always. We'll
Thank
see you
you.
all very soon at the next session, which is day after tomorrow. And goodbye, everyone. Take care and stay safe. Thank you so much.
Thank
Goodbye.
you.
Thank you so
Thank
much.
Thank you, sir. Thank you, ma'am.